thank you everyone for coming on. I know we are literally calling in from all over the world, and that's the beautiful thing about this business is I'm in a hotel room in Christchurch. We have Dr. Jeff over in Florida, and we have Charlotte who's running the Zoom in Australia, and that's the beautiful thing about this industry. So thank you so much, Dr. Jeff, for coming on this evening and just helping to educate us and maybe some of our customers really on really about this GLP. So a little bit about Dr. Jeff Piccirillo.
Got it.
Right, Piccirillo,
Yep.
great. So Dr. Jeff is has been a board certified orthopedic surgeon, but for the last 5 years, you've really gone into regenerative medicine. You have your own med spa where most of your clients come to you with weight loss, sexual health issues, and that's who you've been able to help. So Dr. Jeff, I know you've really just partnered with LifeVantage recently,
Mhm.
and the reason for this has been because of this new product, GLP1, and that it is activating the GLP1 hormone naturally, and that this was something that really, really excited you. And I know that for you to have partnered with our company, you would have had to have done quite a bit of research on the products and things like that because you're talking to a lot of your clients. So I'd love you to maybe just share with us, why what was it that was so exciting about this new product that we have actually brought out, and what's so exciting about the GLP-1 hormone, because a lot of us have heard about it out there, especially in the synthetic form. So I'd just love for you maybe to share about the importance of this hormone and what's so exciting for you about this product that we've just launched.
Thank you so much, and thank you everybody for coming on. I know it's the weekend over in Australia and New Zealand, and Friday night here in the US. So, what is GLP-1? And this was amazing. I've been using GLP-1 in the office in the prescription form, injectable form, for probably the last 2 to 3 years, and we've been having mixed success. We've had people. Our dropout rate was probably about 40%. People dropped out for price. People dropped out for side effects, mostly the GI side effects, either really bad constipation, really bad diarrhea, nausea, esophageal reflux. So we saw a lot of people drop out. And we saw people at least initially drop out because they weren't losing weight. And I figured out very quickly why that was. And we're going to talk about that a little in probably the next 5 minutes. But what does GLP-1 do? It increases your insulin secretion. It slows down your digestion. It suppresses your appetite. And then the bottom two are things that we recently learned. It supports cardiovascular health. So it is cardiovascular protective, which is really important on the diabetic side. If you're on one of the GLP-1 medications for diabetes, your diabetes increases your risk of heart attack and heart disease. So it's actually protective to the digestive tract. It's protective to your brain. It's also protective to your kidneys. The physiology behind it is it's actually made in 3 different places. It's made mostly in the lining of the GI system by something called L cells, but it's also made in the pancreas, the same place insulin is made. And it is made in the brain. It responds very well to 2 very important brain neurotransmitters called GABA and glycine. And that becomes important too at the end of this talk. So it really is a whole body, and we're talking about it for weight loss, but it is a whole body hormone that is really dependent on different aspects of your overall well-being. So GLP-1, or the real name glucagon-like peptide 1, natural occurring hormone. And what it really is, it is an analog to glucagon. So what you need, the only thing you need to understand about like the science behind this is when we eat, insulin goes up, glucagon goes down. And as we digest, they start moving the opposite direction. And so when we're hungry, when we're hungry, we have increased glucagon in the system. And so what this does is this competes for the receptor site for glucagon, and it blocks glucagon from doing what it's supposed to do, which is make you hungry and stop insulin from being released from the pancreas into the digestive system. So this is why it works for weight loss. It allows us to not feel hungry, to always feel full, and it slows down digestion. So we do not have that need to be eating all the time. The amazing thing with the mind-body GLP-1 is that I did not notice. I was on the injectables for about 8 months. And honestly, you know, we're all adults here. I had diarrhea every day for 8 months. It was awful. I hated it. I was losing weight, but I hated being on it. And the one thing I've noticed about the mind body is none of the GI side effects and no food noise, which means I can walk past the pantry and I know there's 3 boxes of Oreos in there, and I haven't touched an Oreo in 3 weeks. There's just no desire. Last night here in the US was Halloween, and we had 600 kids come to the door trick-or-treating, and I did not touch one candy bar, which is, I would have eaten half the bowl. So completely unusual for me. So this is the system, the mind-body GLP-1 system, released here in the US 3 weeks ago today. We do have a clinical study, which is amazing. And that's one of the reasons that I jumped on board, is that most companies like ours do not do clinical studies. They'll do a white paper, or they'll pull a study from one of the ingredients, and they'll say that that's their study, and it doesn't work that way. So the company actually did a 12-week human clinical trial, and what it showed, and I think all of these are important, it showed that GLP-1 as a blood test, stick a needle in your arm, draw a tube of blood, send it to the lab, look at it. GLP-1 was increased by an average of 140%. That's the average. I talked to some people at the launch in Kansas City that were telling me that were in that initial study, that were telling me their GLP went up 320%. And that's just crazy to think about that. Average weight loss, and this is important because you got to look at these numbers. The average weight loss was 9 pounds in the first 8 weeks, but an average of 25 pounds by 12 weeks. So the last 4 weeks is when people were dropping most of their weight. They were dropping about a pound a week initially, and then it picked up. That's important because I know there's people that are getting frustrated that have been on it here in the US for the first couple of weeks, and they said, you know, we're not dropping much. We're seeing some inches go away, but the pounds aren't dropping off. Completely expected, not unusual whatsoever. The next 2 were mind-blowing for me. 100% of the people in the study did not lose muscle mass. We would see people that would come into the office and they would lose their weight. They'd lose 60, 70, 80, 100 pounds, but they also lost muscle. One of the things we kind of joked about, we named it Ozempic butt. So Ozempic butt was the fact that they lost 80 pounds, but now their backside was all droopy and hanging down, and they either had to go to the gym or they had to increase protein because they lost muscle mass. And with this, in a 12-week study, they lost no muscle mass. The next one is they lost up to 27% in visceral fat. Visceral fat is important to understand. Visceral fat is the fat that's around your organs. It's the fat that's sitting around your heart. It's the fat that's sitting around in your abdomen, around your intestines and your colon and your stomach. This is the fat that increases your risk of heart attack, increases your risk of stroke. I'm sitting in Kansas City at the meeting, and they announced this, and I initially thought, oh my God, this is amazing. But the next thought that popped in my head is, it's amazing, but what do the prescription injections do? And so I Googled it, pulled out my phone, went on Google search and said, you know, what does Ozempic, how much visceral fat is lost on Ozempic? So I Googled it. Ozempic, the average visceral fat loss on Ozempic was anywhere from 3.5 to 7%. So this is causing about 4 times better loss in visceral fat than the prescription drugs. 82% took control back with their relationship with food, and 95% had a decrease in sugar cravings. This is what it looks like. The hormone is the dark green. It binds at a receptor site. And if the hormone is glucagon, it increases your hunger. But if the hormone is GLP-1, it blocks the glucagon from binding, and it allows your insulin to remain elevated and decreases your overall hunger. That's how it works. So what are the statistics? Obesity is a huge problem. And I changed it today, and I did not change the United States. I looked up the Australia facts. So 67% of Australians are overweight, and 3 out of 10 Australians are obese. It's a huge problem. It's a huge problem for society. It's a huge problem for healthcare. So let's look what it was like in the 70s. In the 70s, the obesity rate in Australia was 1 in 10, only 10%. There was less thyroid disease. There was less problems with menopause, and there was almost no kids on the autism spectrum disorder. So why is that? What's changed? And this is the important part. What's changed is our diets now are all ultra-processed foods. And so ultra-processed foods increase oxidative stress in our system. The oxidative stress then shuts down our hormones that are responsible for our metabolism. So thyroid hormone, testosterone, estrogen, and human growth hormone. As those go down, we put more weight on. Increased weight or obesity causes more oxidative stress. So you can see that this becomes a vicious cycle. So what is oxidative stress? Oxidative stress is essentially rust. If you put a nail and you leave it outside in the rain, it's going to turn into rust. If you leave a tomato out, it's going to turn from a red tomato to a brownish green tomato to a pile of goo. And cells do the same thing. That's what happens when cells are affected by free radicals. And so that's what's happening in our cells as our oxidative stress goes up. So this is the whole process. More highly processed food, more free radicals, more oxidative stress. More oxidative stress, downregulative hormones, more obesity, more free radicals, more oxidative stress. That's why I think that, in the US now, the MindBody GLP-1 is on back order. I think it's going to be the same thing. I know Grainne is going to talk about it, but I think the back order is a blessing. And here's why. Because Protandim will lower our oxidative stress. It's going to give us the jump start that we need. In my practice, when we had people come in from other offices that said, hey, my friend is a patient here, and they said they're losing weight on your program, but I was over at Dr. XYZ's office and I wasn't losing weight. What are you doing differently? What we were doing differently is we're checking lab levels, and we were getting their hormones aligned first, either giving them hormones, and then once I got associated with LifeVantage, giving them Protandim to help regulate their hormones. So it's important to make sure that your gut is stabilized. So both our probiotic and our prebiotic are perfect for that. And then, as I told you, the brain plays a role in this. So we need those neurotransmitters like glycine and GABA to play a role in this. So being on the Axio to get good brain health, good neurotransmitter health, also an advantage. So yes, it's back ordered, but the back order is a blessing because you can use these 3 to help get your system, get your body ready. And then when the GLP-1 comes back available, I guess it's about 6 weeks, you'll be ready to go and you'll have a very successful journey on your weight loss. So that's kind of my summary, my quick summary on what is GLP-1, why does it work, and why does our bodies have to be tuned up? So I think I know Grainne has some other questions. So
Yeah, look, one of the big things for me, so for those of you that won't know, um, I put on 20 kilos. I hit menopause 2 years ago, and I do Pilates every single day. They say, like, I was even doing it 10 times a week, trying so hard to lose this weight that was just coming on. And I walk 15,000 steps. I do intermittent fasting. And it was just like, seriously, I think one of my hardest things was when I actually couldn't tie my shoelace anymore. I just couldn't bend over. I had to lift my
yeah,
shoe up. And I thought, this is
yeah.
just, I can't keep doing this. So I actually went on Ozempic, and then we couldn't get it, and I did the compounded, and then we couldn't get it, and then I did Mounjaro because I was desperate. I just wanted
Mhm.
to be back me. And I probably didn't have the worst side effects like you, and I did lose some weight, but I chose, once I knew this was coming to our company, I came off about 6 or 7 weeks ago. And I have to say, I've been on the product now just over 2 weeks. And there was about six of us that started at the same time. And my experience and everybody else's has been very different. I
Yeah.
probably detox more, and I've still got a bit of food noise, and I haven't been losing the weight yet. So if
Mhm.
you can just maybe explain to people, just to encourage them, what actually happens when they take a synthetic and why mine is different to everyone else that hasn't
Well,
done that.
and when you take a synthetic, that's going to set you back even further. And here's why. If you've been on the synthetic, when you inject the synthetic, your body finds that synthetic and says, oh, there's plenty of GLP-1 in the body. We don't need to make any more. We can just shut down the system, not make any more GLP-1, and not have to worry about it. And so what happens when you finally go off of it? Well, when you finally go off of it, your levels are at zero. You have no GLP-1 in your system at all. And so now you've got to start either naturally building it up, or if you go on the mind body, that's going to help you build it up faster. But you may not get up to a normal level for several weeks by doing that. So it really does put you on behind the eight ball to be on the synthetic ones first. And then your hormones play a role in it. If your metabolic hormones, thyroid, testosterone, growth hormone, are all downregulated because you've just never really paid attention to them, that's going to slow your process as well. So, I guess the best thing is just stick with it. It will come. One of the things I'm seeing here, and even with myself, I started losing inches before I lost pounds. So that, I think, if you're checking that, or if you have a smart scale and you're looking at some of the numbers, you'll notice things starting to equal out before you actually stop dropping weight. So don't get
Yeah.
discouraged.
Oh, look, I'm not. I know that I've kind of done some damage, but would you as well? Like, different people are at different stages. I know some people are losing, like Charlotte's just said she's lost 44 centimeters in 2 weeks across the body, which is
Mhm.
phenomenal.
That's
Um,
astounding. Yeah.
yeah, but my daughter hasn't, and she's not on a synthetic. And I just said to her, she's 18. Who knows what's going on? I said, you just got to keep going with this and just trust the process.
That's absolutely correct.
Yeah.
Yeah, I think it's gonna be very successful for everybody in the long run. I just think that you have to just give it time to work. You don't know where you're starting from. We don't do GLP-1 levels, in regular clinical practice. That's something they do in research studies. So we don't know where you're starting. And so we have to let the body find its steady state, and then it'll start to work.
So what would you say to people as well about we'll finish with this. I think there's a couple of questions we'll quickly go to, but what would you say is the long-term benefits of being on GLP-1 as well? as well as just the weight, you know, there's a lot of other really great long-term benefits, isn't there, to activating this?
Yeah, there is. I mean, you know, as I said in a few slides earlier, yes, obviously losing weight is going to be helpful. Controlling your blood sugar, if you're pre-diabetic or even if you are diabetic, getting your hemoglobin A1C down to a normal level, all great things for overall health. But we know the GLP-1 is heart protective, so it's going to decrease the risk of heart disease. But the bigger thing is we know that by decreasing visceral fat, we're going to decrease the risk of fatal heart attack, and we're going to decrease the risk of stroke, which are huge, you know, huge problems and huge causes of mortality, both in the U.S. and in Australia, New Zealand. So by decreasing that visceral fat, that's gonna really help things. And then the other thing that we're seeing, and we're not really sure, and I've been looking at a lot of articles, it really does help with our reproductive health. We know that there's a link that it helps raise luteinizing hormone. They started using it in infertility. It increases luteinizing hormone, which in turn increases estrogen. Actually, some women that go on GLP-1 for the first time will sometimes develop some breast tenderness from the increased estrogen. And so it's going to help. It's going to help your overall sexual health as well. There was a study that I read today, and I'm actually going to do a video and put it on my Get Activated with Dr. Jeff site. I might do it tomorrow. But there's something called Ozempic babies, which I had never heard the term before. There are people that are having babies while taking Ozempic that weren't able to have babies in the past because it increases fertility and it increases sperm mobility in men. So I guess both something good and a little caution. You might need to be careful. If you're not on
Yes.
birth control because you didn't think you could have babies, might be a good idea if you don't want one to use birth control, because this Ozempic baby thing, at least with the 2 articles I read today, seems to be real.
Okay. Look, we've got just a couple of questions, and I
Sure.
know that we cannot claim to treat, cure, mitigate anything,
Nope.
but somebody who may be on insulin at the moment, they should maybe bring the ingredients, show their doctor. Is that something you'd be
Yeah,
suggesting?
you know, that question was asked today. They said, what should I tell my doctor? And, you know, the short answer is tell them everything. You know, don't hide it. I mean, even if you tell him, hey, you know, I'm thinking about doing this, what do you think? And if he's a little skeptical, I mean, just tell him, you know, I'll check my blood sugars more. You know, I really want to do this. If he's willing to talk to somebody that's gone down this pathway, like myself, I'll be more than happy to talk to doctor to tell him that, you know, how we dealt with it and that it's completely safe. But yeah, I think you got to tell your doctor everything. I think, you know, you can't. I know I always got upset when, you know, a patient would come in and, you know, you'd catch them in a lie about something. The biggest one was, no, I don't drink. And then you'd bring them in for a surgery, and the second night they're going into DTs from alcohol withdrawal.
Yeah,
They
no.
probably drank, you know, they just didn't want to tell so you got to tell your doctor everything.
Okay. And look, somebody that may have had a stomach operation, are they okay to go on this product?
Yeah, it shouldn't be an issue. We started using it on several people that have done any type of the bariatric surgery. So we have had some people that have done it, who've done gastric bypass and put their weight back on, has done a lap band and put their weight back on. So I think it's fine with all of those. I don't think there's any issue at all using them after bariatric surgery.
Right. And look, someone's just said, what about people coming off or still on cancer treatments? I mean, again, I think it's just go back to your doctor. That's all we can
Yeah, I
suggest.
think talk to your doctor. I just had this conversation. So, and once again, as we said, we're not here to give any kind of medical opinion and don't use me as, oh, Dr. Jeff said that it's completely
No.
safe. But we just had a friend of the family, is actually a lady that my wife considers her second mom, just had breast cancer, underwent surgery, and went to her doctor, and her doctor said, you really need to lose weight. And she said, oh, well, it's funny that you say that, because my friend, who's also a doctor, has this new product. It's a natural GLP-1. I was thinking about starting it. And he said, absolutely, go for it. So
Right.
with that being said, I mean, he realized that it was all natural, but that's a conversation you really need to have with,
100%.
especially with with cancer and protandem. There's two big schools of thought, and I'll probably leave it at this. There's some cancer doctors that say, oh, absolutely, get rid of your oxidative stress. It's going to help you do better, feel better, not have the side effects from the cancer drugs. And there's some cancer doctors that say, no, I want your oxidative stress really high because it's going to help kill the cells more. So I don't want you to downregulate it. So talk to your cancer doctor.
And do you know, finally, I know because the time is of the essence. So,
I'll stay here all night and answer questions, but I don't know if you want to hear me.
one thing a couple of people have just said there is about overweight teenagers. Now, I know some have gone to pediatricians who have said, we want them to go straight on medication, blah, blah, blah. And they've said, oh, I think you need to be careful of doing something natural. And they're like, I don't really want to give my kid something that's pharmaceutical when they're teenagers.
Yeah.
Would you recommend the same kind of dose for them?
Yeah, I don't think the dosage changes really, even I mean, unless they're really young, preteen or tweens, they're at 12, 13, 14 age. I think they should do well on it. We just actually put a pediatric nurse practitioner on our team. She was interested in using it in her practice. And so, yeah, I think it'll work very well in adolescence. Yeah.
Well, I just want to say thank you so much. I think this will be a fantastic recording to send to people. I appreciate you helping us so much. I love LifeVantage. As Dr. Jeff said, we have a Kickstart bundle that has literally just come out on the 1st of November across Australia and New Zealand. We are on back order till the middle of December. So why not get your body activated, reduce the oxidative stress, get your energy levels, clean out your gut with the probio. So get back to the person that recommended you to this, and let's get activated, and let's get this GLP-1 hormone in us and activated in us. I want to thank you so much for this call.
Well, thank you for the invitation.
Thank you. Bye, everyone. Thanks for coming on.
Have a great weekend, everybody. Bye-bye.